Hi everyone. Thank you for joining and watching our video today. I'm here with my colleague Marla Hamilton. She's a mental health counselor, and I just wanted to welcome you and say hi, Marla. How are you?
Hi, Karen. I'm good. Thanks for having me.
Good. So this morning we're looking forward to having a conversation about what you do and what led you into this field. And I think your story is really interesting and telling for a number of reasons. But first and foremost, aside from being a mental health counselor, can you share a little bit about your background and what led you into this wonderful field that you're in now?
Sure. For many years before I began my work at Passages, I worked as a postpartum doula. So, that I can tell you a little bit about what a postpartum doula does. My biggest job, my overarching work was the same as was it what it is now, which is supporting moms and supporting families through transitions in their life, through the transition to parenthood or to having more children. I came to this work at Passages through my work as a postpartum doula. So what I did for many years before I came to this work was supported families as they were welcoming new babies in their homes. I provided my spiel, my kind of like little elevator pitch was always as a doula that I
Hmm.
provided physical, emotional, and informational support. I'd work with people for a few months at a time, right after their babies were born, all the way up to when their babies were 1 year old and provided them all kinds of support. Sometimes it was cooking meals for them. Sometimes it was things like teaching them how to give a little slippery baby a bath for the first time.
Oh,
Things like baby wearing, like light housework, just all the different like teaching them and supporting them through all the different things that come when you are becoming a parent or growing your family. But so much of that work started to be about the emotional support piece and the mental health piece. And I saw how much of a need there was.
yeah.
And I had a mental health background. So that was when I decided to go back to school and go for my license and look for an amazing practice that gave wonderful perinatal mental health support. And that's how I wound up at Past.
Yeah, we were really lucky for that. So when we take on interns, obviously we look for someone that's a good fit, but you were the perfect fit. So doing the postpartum doula work, having the background that you did, we were really lucky to have you as an intern coming in with just a really great understanding of a large part of what we do. About half of our practice, if not more at times, are women who are looking for perinatal care. And often postpartum. But I think that understanding has really been an asset for you, for us to have you. So when you decided, we were lucky enough to offer you a position that was a great fit. Can you talk a little bit about your transition from doula to mental health counselor and what it's been like? So maybe what's the difference, when someone is in need of mental health or even would benefit from mental health services? What are the things that you notice? What do you look for that indicates a person might benefit from a referral?
Yeah, that's a really good question. So I felt like sometimes as a doula, it felt like I would use a lot of those counseling skills through the emotional support, but I would be with people for say 4 or 5 hours at a time, which would not be that would be a very exhausting therapy session. It would also be, I feel like now I became more, when I was a postpartum doula, I was trained to look for those symptoms of perinatal mood and anxiety disorder. So I knew when to refer out to appropriate mental health support. And now I am the appropriate mental health support, which is amazing. I loved postpartum doula work. I mean, I like it was so gratifying and meaningful and fantastic. But there were times that I think that the two can work really well together. And I feel
Yeah.
like a lot of times as a therapist, I am always talking to new moms about what their support system looks like and how they can build it up as much as possible, which might include some professional help,
Yeah.
like a postpartum doula. But but now I'm really dealing with more of the underlying issues and helping people with their
Yeah.
mental health symptoms. Whereas there's definitely like more of a physical component as a
Sure.
postpartum.
Yeah, yeah, and I think that's a really important distinction. And I'm sure there was so much overlap when you were in people's homes for that much time, you're going to see things. But also know within the scope of practice that it isn't something you're going to be able to fully support. So, what are some of those differences? Can you describe a little bit about the a PMAD or a perinatal mood or anxiety disorder and what that looks like? Maybe something you would look out for.
Sure, sure. I think it's important to for everyone to know because some people will get worried when they first, and the nice thing is that there is so much more public knowledge than there was, say 20 years ago,
Yeah,
but it is completely biologically normal, common to experience some sort of form of the baby blues right after you give birth up to the first like 2 to 3 weeks. So your body basically has this massive hormonal crash all the hormones that were needed to keep that baby growing and make that pregnancy get all the way, do everything that your body needed to do in order to sustain life. And now the baby's on the outside. You could imagine how much of a
yeah,
change has to take place within your body. So naturally, all of those hormones, all of those things that go on in your body can have an emotional effect. So that would be like tearfulness, lots of ups and downs, just being really emotional, just, that kind of, but also there's usually some joy present as well, and people still feel like themselves, and then it kind of goes away after 2 or 3 weeks without any intervention. So that is something that would be, that doesn't need any significant support, anything else. When something starts to go on beyond that, you start to see other symptoms. I can talk a little bit just about postpartum depression and postpartum anxiety, with those two
yeah,
being the most common, or being very common. So for postpartum, and they do have some overlap too, but
yeah,
with postpartum depression, you would see, with both of them, you would see some sleep disturbance and some eating disturbance. But with postpartum depression, the feelings of overwhelm, lack of connection with your baby, feeling like having a really hard time caring for yourself or your baby
yeah,
beyond kind of typical. Like, yeah, of course, you're maybe not showering as much as you did or getting all dolled up. But if you're not really feeling like you're able to function, that's a major thing that we look out for. Are you really isolated? Meaning, and again, I think most people could use more support than they
sure.
have, but are you having a really hard time even reaching out to the people that are in your life? Are you feeling really
Yeah,
easily irritated? And is there that overall, I just don't feel like myself
yeah,
feeling? Um, and then with postpartum anxiety, and again, a lot of times the two occur together, but with postpartum anxiety, there's more of like a worried tone to it. It would be
yeah,
excessive worry about, a lot of times it's about mom's health, about your own health, about baby's health, about your baby's development. That feeling of just difficulty controlling that worry, where like even though you know that it might be something that's kind of irrational, it just keeps going. um
yeah,
Ruminating and really persisting on those thoughts, and in addition to, like I said, a lot of times there's that sleep and eating disturbance. But with
yeah,
postpartum anxiety, it would be more like really a really difficult time sleeping, kind of just being like revved up and on edge all
yeah.
the
Yeah, those are, and there is some overlap. I think that's a really great summary of the symptoms that you would say this individual, this woman would benefit from more support. I'm wondering too, there's a thing that women talk about that sounds so scary, but to mention intrusive thoughts. Can you talk about that? I know that that can be a part of postpartum anxiety, and it can be really scary for a mom or for a partner to hear a woman's having intrusive thoughts, and just a little bit about what that is.
Yes, I think it does sound so scary, but I think in most of the time that can be, there's like an evolutionary biological reason
Yeah,
for it. And lots of people have that who do not have a perinatal mood and anxiety disorder. I think like on some level. So I'll talk about when it's not
Yeah.
when it's not a red flag, when it's not
Right.
something about that, in some way our brains maybe have adapted to look all around us for possible threats. I remember with my youngest son, I used to think about like was I gonna like hit him into something? I would walk past a wall or walk past a
Yeah.
doorway, and it was always that would always just like flash into my mind. And
Yeah.
people have all kinds. I mean, I don't need to go into all the details, but there are just
Yeah.
lots of people have little things.
Dropping the baby, or yeah. I had
Exactly.
that with the doorways and the walls too.
You
You're
did.
like you're navigating, yeah, because the baby extends beyond your body, and now you
Yes.
have like it's a it's a new way of thinking, and you might be overthinking it at times. Yeah.
Yeah, so some degree of that is normal and just a part of your development as a parent. Um, Sometimes, like, and if you recognize that this is a disturbing thought, this is not something I want to act on. This is something that I can still function and kind of distract myself and move on with my day.
Yeah.
There's no delusions, you're not seeing anything that's not really there. Then we can accept, and it's not completely disruptive in terms of your
Right.
functioning, your health and happiness, then that's something we cannot give too much thought to. And in all likelihood, that would dissipate on its own. If
Mhm.
it's recurrent and it won't go away, and it's disturbing to the point that it's impacting your behavior, like you're not walking through doors anymore,
Right.
right? Or and it's really impacting your ability to bond with your baby because you are so worried about these certain things that you're not able to connect to them in the ways
Yeah.
that you or there is some kind of delusion or hallucination present that is and it's not disturbing to you if you're not able to differentiate that these things are not reality, and you don't find it disturbing because there is something else present that makes you feel like
Right.
this is, oh no, like this intrusive thought that's not really based on reality is reasonable, and I do need to operate my, change my functioning around it. Like that's when we would that tells us that something else is going on that requires more attention.
Yeah, so that would be a red flag, as you were referring to before. That would be a red flag. Yeah, and that is less common, but intrusive thoughts nonetheless. It's so good if someone comes into treatment and is so upset about having them and judging themselves to just get that help and support. So, what would support look like with someone who had a mood or anxiety disorder, a perinatal mood or anxiety disorder? What does it look like with you?
So it will look it's a multifaceted approach. I mean, because of my postpartum doula background, I am always going to be working with people trying to identify their support systems, what kind of sleep are they getting, what are they eating, and trying to normalize how much those things impact your mental health and like what can we put in place to help you build up those things in your life because like none of us can operate well without sleep or without
For
proper
sure.
nutrition,
Yeah.
hydration, all that stuff. So that's kind of my, um, I will always sort of be slanted or biased in that direction.
Yeah.
But a lot of the themes that we wind up looking at, accepting help is a huge one
Yes.
because motherhood is not something that is meant to be done in isolation. None of us would be here if our ancestors had
Yeah.
done any of this in isolation. There is just no possible way. But a lot of us have this funny relationship to accepting help and feel like it indicates some kind of weakness or
Yeah.
needing it means that we failed somehow. So there's a lot of looking at that and where did we get that from and do we actually really believe that and what is feasible and how can we accept some help anyway and take it from there. The relationship changes that come after you have a baby are often a really big theme and can cause a lot of distress with people,
Yeah.
whether it's relationship with a partner, even like as your roles change, maybe your relationship as a child, as a sibling, as all of those different pieces. So working through those relationship difficulties and also working on communication skills. That's a really big one too. Often for a lot of people, there is some degree of needing to process their birth, whether they've experienced a
Yeah,
birth trauma or not, just being able to, it's a huge change. It's a huge event that you've gone through to be able to process that and really give it the due that it needs.
absolutely.
It's
Yeah,
so significant. And there's the identity changes that come when you go from, being only responsible for yourself or maybe, feeling responsible for a pet to being all of a sudden responsible for a human life or multiple
huge.
human lives
Yeah,
and how you
yeah,
balance that. Um, there's a lot of like working through the expectations for motherhood, which I think are often not necessarily grounded in reality to like
yeah,
what the reality of what it feels like is and like what do we make that mean about ourselves, like how it actually feels for us. Um, and also like learning how to connect outward with our community. Because again, this is not meant to be done alone in
absolutely.
any way, shape, or form. I think sometimes people are operating in a little more of an isolated way, or like their partner is their main emotional support. And then once they welcome a child, they realize how much that even the most wonderful and supportive partner in the world, that is not enough. We need to feel like in order to give our children everything that they need, that we are surrounded by support
Yeah,
from lots of different
yeah.
people.
It's such a culture shift from a time where maybe there, like you said, that we did live closer to family or maybe family members were younger. I mean, we see a lot of women who have older parents who aren't able to care for their children and to help and pitch in. Um, yeah, and the isolation piece, I think that's just across the board of we're more isolated than ever. So, what are your thoughts about? I think maybe this is a good like final thought on if a woman is deciding to come in for treatment and she's thinking, well, it's really not that bad. I'm not, my birth wasn't, it wasn't what I expected, but I'm okay and the baby is healthy and I'm not having intrusive thoughts that are as disruptive as the ones you were just describing. I just feel like not myself exactly. I'm a little anxious or a little different, but that's to be expected. I'm a new mom. What would you say in response to that? I don't know if I need help.
I mean, I would say that the transition to parenthood is monumental enough, especially in this day and age with the lack of support, like we were talking about. That's just kind of like the way our society operates. I think that transition is monumental enough that everyone deserves some mental health support during that time to kind of look at
Yeah,
um, how can my relationships be like what changes can I make my relationships more supportive? How do I feel about the way that I was raised and what do I want to bring forward and with myself as a
yeah,
parent? All those kinds of themes I think are relevant to anyone, but I also would just warn anybody against that. Like, I don't like that whole thought. And I think we do moms a real disservice of like, you're a mom now. Of course you're not sleeping. Of course you're crying every day. Oh, that's part of it. That maybe there are so
yeah,
many pieces, again, culturally, that the way that we treat parenthood and motherhood now that lead to a lot of these different emotions and situations that are like common, but they're not normal. And I don't want
yeah,
anyone to accept not feeling like themselves. I don't want anyone to accept just being in this state of distress, even if they're not a danger to themselves or anyone else, where that
right,
would be more of an emergency situation. I just think
right.
that in terms of like for our families to function better, so we can do these things the way that we want to, so we can enjoy our lives. I think that I don't want us to accept this like subpar kind of mildly
Yeah.
suffering at all times.
Yeah, like so, yeah, that we're normalizing suffering. I mean, you've said that so many times in our work together, and I love that you feel so passionate about that. So, I thank you so much for all of the information that you brought to us, and I do really feel like if you had maybe one thing to say to women for postpartum, what would you say? Is there any like parting thoughts, word? You kind of said
I
so
would
many great things, but yeah.
I would say help is normal. Help is
Yeah.
natural. That is just exactly. It is not a weakness. It is going to be so good for you. It is going to be good for your baby. It's going to be good for your whole family. It's going to be good for the world. You just
Aw,
help. We
you just
all
have,
need it
yeah,
at every stage, but especially when you
I
have
love
a baby.
it. Well, thank you so much. And with help, it does get better, doesn't it?
Absolutely.
So yes, so thank you so much for what you just shared. Your expertise is invaluable, and I think your passion clearly shows through. So we've really been, just loving having you with us and look forward to all of the clients that you're going to continue to see. I know your clients are really lucky to have you right now. Thank you, Marla, for this lovely conversation. And thank you all. If you like what you're watching, please subscribe. We are on Facebook, Instagram, passageswomen.com is our website. Follow all our handles, like and subscribe. And certainly, if you're looking for treatment with a wonderful postpartum experienced, perinatal experienced therapist, Marla is a fantastic choice. So thank you again, Marla, and we'll see you soon. Take good
Thank
care of
you.
yourselves. Bye bye.
Bye.